This morning, some breaking details, a new report card from the Canadian Institute for Health Information. It's grading a key part of Canada's healthcare system, access to primary care. This looks at post-pandemic data, and Brett Ruskin has been looking through it to bring us the main takeaways from this report. What do the numbers tell us, Brett, about the state of things in Canada's healthcare system right now?
Good morning, Heather. That's right. Numbers that are just a couple of hours old in this report from CIHI, the Canadian Institute for Health Information. They crunch numbers from the provinces, from the federal government, and from Statistics Canada to create these indicators about the health of our healthcare system. And so one of those indicators, as you mentioned, access to primary care, the big number here, 83% of Canadians surveyed report that they do have access to a regular family doctor or regular healthcare provider. Now that's a little bit higher perhaps than what many people might think based on how loud the calls have been about getting more family doctors into practice, about the long wait lists to see a family doctor, but it still doesn't cover the whole country. Indeed, there's still 5 million Canadians without regular access to a primary healthcare provider, and the worse off areas are the territories and Atlantic Canada. So here is CIHI's Vice President of Marketing, of Research and Analytics, talking about some of the things that other provinces are doing to try to improve and increase access to frontline care.
In some provinces, they've actually made more of a focus on some kind of team-based care where there's a physician, but you may also have a nurse practitioner there. You may have a nurse that can provide telephone advice. They have a range of different services, or they may treat some common problems in group settings. So there's different models that people have, and I think there's a lot of effort going in right across the country at trying to make sure that people have the frontline care that they need.
So different models, different ways to solve or to come to a solution about frontline care. Again, frontline care, regular access to healthcare providers, is one of the many indicators in this new report from CIHI, the Canadian Institute for Health Information today. Heather.
Another of those indicators, Brett, is surgery backlog and wait times. What's the latest information in this new CIHI report on those?
Yeah, so let's take a look before the pandemic. 2.2 million surgeries done in Canada, according to CIHI's analysis. Through the pandemic, that dropped significantly to 1.85, around there, million surgeries under the strain of the pandemic. We've since come up to 2.2, once again, meeting that pre-pandemic level. And these latest numbers show that we've surpassed those pre-pandemic levels. So 2.3 million surgeries throughout the country, surpassing the pre-pandemic levels. So some good news there in terms of possible wait times, shortening those, increasing access to these surgeries. This is the second time that CIHI has done this type of structured report, so it'll be interesting to see in the years ahead to see some longer term trends with these indicators. Heather.
Brett Ruskin in Halifax, thank you very much.